Hello and welcome to this channel. My name is Victoria, and in today's video we will talk about melanoma. It is a type of cancer that is arising from the melanocytes. The melanocytes are found in the basal cell layer of the epidermis and are those cells that produce melanin, which makes us appear tanned and determines our eye and hair color. Most often, melanoma develops in areas that are frequently exposed to sun, so places such as the back, legs, arms, and face, but also places that are usually not exposed to the sun can develop melanomas, as for example the soles of the feet. Usually when a doctor says melanoma, he or she is referring to malignant melanoma. However, there is also the juvenile benign melanoma. It is also called Spitznevus. It usually occurs in children, it is usually solitary, and usually in the face. It often grows rapidly and appears as a thick, pigmented knot with telangiectasia around it. Differentiation between malignant melanoma and non-malignant melanoma is done histologically. Here the difference is that in the benign form, there is only visible mitosis occurring in the apical part of the biopsy, while towards the basement membrane, the melanocytes are mature and non-dividing. Also, the malignant form has subforms. Those are different from each other in their form and appearance. We differentiate the superficial form, which usually grows primarily horizontally. It makes up around half of all melanomas, and histologically it shows atypical melanocytes with light cytoplasm and cellular atypia. The nodular malignant melanoma makes up around 20% of cases. This type of tumor grows deep into the tissue and usually affects back, breast, and the extremities. It can be pigmented or unpigmented. Histologically, we can observe epithelioid and polymorphous melanocytes, and also here we observe features of cellular atypia. The lentigo malignant melanoma is a form typically affecting elderly. This form develops from lentigo maligna, which is a pigment change in the skin of elderly patients. This form usually grows slowly and horizontally, but presents with uneven borders and irregular pigmentation. The epithelium appears atrophic, and the melanocytes are often aggregated in clusters. Another form of melanoma is the amelanocytic melanoma. It's also called amelanotic melanoma, and it describes those melanomas that don't originate from a nevus and are unpigmented. In general, there is an easy way to remember the features of a malignant melanoma. Here we remember the ABCDE rule, where A stands for asymmetrical shape, B stands for uneven outer border, C stands for irregular color or very dark color, D stands for diameter and usually means a diameter larger than 6 millimeters, and E stands for evolving, so changes of any of the characteristics. And now I want to talk about treatment. Treatment depends on the stage of the melanoma. If it is discovered very early, usually surgical removal with a large resection border is sufficient. If it has spread to lymph nodes, those will be removed also. If the spread occurred to other distant sites, the options of treatment include immunotherapy, targeted therapy, radiation therapy, and chemotherapy. The prognosis of melanoma is generally good. The 5-year survival rate of all people that had melanoma is 93%. However, the prognosis changes immensely when the melanoma is detected at a late stage. A stage 3 melanoma has a 5-year survival rate of approximately 63%, and a stage 4 melanoma of approximately 22%. Prevention of melanoma is essentially to avoid excessive sun exposure, so to limit the duration of the time in the sun, to use sunscreen, wear a hat, t-shirt, sunglasses, and so on. That's it for this video. I hope it was helpful, and if you like our channel, please subscribe. Thank you very much.